Now I'm going to show you an exercise called 90-90 diaphragmatic breathing. And this is one of the simplest, yet probably one of the most profound exercises you can do to help rewire a lot of patterns within your body and bring things back into alignment. This will increase your lung capacity and get your rib cage and mid-back to move the way it's supposed to. This will downregulate your nervous system, calming it down and taking you out of a lot of muscular spasms that are caused by the fight or flight response. This will unwind the connective tissue through your hips, low back, and into your mid-back to help your low back, mid-back, and hips come into better alignment. And overall, this helps your system to integrate. So, for this exercise, you're going to need a chair and 1 to 2 pillows. What I'm going to have you do is put your legs up on the chair like so, and you're going to lay flat on the floor. There's a couple really important things just about the setup. The first one is that a lot of people tend to have their butt slid away from the chair like this. Notice this isn't a true 90-degree angle. I want my knees to be in line with my hips. Slide up to the chair like this, or pull the chair toward me. And I also want my lower legs to be at a 90-degree angle bend here. So if you have your pillows too high like this, it's not the right position. The last thing for the setup is to make sure that your heels are not touching anything, that they're actually hanging off the side of the pillow or bolster or whatever you're using in order to prop yourself up here. Now you want to have your butt on the ground here, right? The back's nice on the ground. And what we're going to do in this position is now drop the arms out to the side. Now I'm not bringing them any higher than my shoulder level. And this is very important because once you start to come up higher, the rib cage starts to arch a little bit and you engage the mid-back. We don't want that. So what I'm going to have you do here is just feel this position and feel your body on the floor. Get a sense of where the pressure is. Does it feel like your hips are rotated more one direction or the other direction? Does it feel like one side of your back is pushing into the floor while the other side is raised? These are all indications that you're out of alignment and that this is going to be a great exercise for you. If you have a tendency to feel like one hip is really driving into the ground while one is more off the ground, take a small towel, fold it, and put it underneath that hip to make it feel like it's supported, the one that's raised off the ground. Okay, so first we're just going to go over some of the breathing mechanics, then we'll go back to this position with the arms outward. For this exercise, this is a different breathing pattern than you may be used to. What you're going to be doing is breathing into the rib cage, and not just the belly, but the rib cage as a whole. So that means all directions. So ideally, I'm breathing into the rib cage. I want it to expand outward and downward and pushing into the floor with that rib cage. This allows the ribs and the muscles to expand, increases your breathing capacity, your oxygen capacity, and gets your diaphragm, the dome-shaped muscle here, to descend the way it needs to so that you can breathe properly and not be breathing up into your chest. In order to get a sense of that diaphragmatic breathing, what I'm going to have you do is put one hand on your chest and one hand on your belly. And I'm going to have you take a deep breath in, and as you breathe in, see where it feels like it rises. What you're trying to target is the lower hand rising and the upper hand here on the chest not rising at all. Once you get used to doing a few breaths like that, and you can feel it rise through the belly, try and now push the rib cage outward and also downward into the floor with a deep breath. So breathe in, feel it push all directions through the rib cage, feel the belly rise a bit, but not the chest, and breathe out. Do about 3 to 5 breaths like that just to get a sense of that. Once you get a sense of what that feels like, you're now going to bring your arms back out to the side. And the breathing is a count of 4 seconds in and 6 seconds out. And ideally, you want to do this breathing through your nose only, because what that does is it tends to regulate the pressure in through your abdominal cavity better. So you're going to take a nice breath in for a count of 4. Feeling the rib cage expand outward, the belly come up a little bit, and the rib cage also push into the floor. And then you're going to gently let that relax for a count of 6 seconds as you release the breath. As you breathe out, try and feel your whole rib cage relax and feel your hips relax. Imagine that the floor is coming up to meet them and support them, and allow the rib cage and the hips and low back and sacrum to all just kind of melt into the floor. This helps the connective tissue to unwind through the hips and the low back in a very nice way. So you're going to do this exercise, you're going to do it for 5 minutes. Set a timer so that you're not distracted, you're not trying to count. The only counting you should be doing is the 4 count for breathing in and the 6 count for breathing out. Once you get set up and used to this, it's really easy to do and actually becomes a really pleasant exercise. You want to do this exercise ideally before you start into activities and after activities, primarily physical activities, or activities that tend to upregulate or excite your nervous system and get you a little bit more into fight or flight mode. This is a way to bring that all back down to earth, get your body centered, and get everything functioning the way it needs to.